Tonight, I kind of knew.
It's me, that permit to the FOG. How the hell are you, everybody? Thanks very much for taking the time to join us. Episode number 3 of the Fogcast for the week of July the 4th. Can't thank you enough for stopping by for this bi-weekly podcast. I came out recently and admitted to my family, my friends, my wife that I am definitely by schedule. I don't get stuff done every week. Seriously, though, just life gets in the way. You know, it happens sometimes to the best of us. I will get on track as soon as I possibly can. As soon as life quits throwing curveballs, which I don't think is going to happen. Other than that, it is, summertime, beautiful weather. Everything's in full swing. Getting the thunderstorms here in Calgary. It's kind of routine that when Stampede Week is firing up, so do the thunderstorms. Other than that, just been, walking the dog. My golden retriever, 9-year-old golden retriever, Daytona. My best friend, my buddy. Doesn't matter what's going on with life, you can always count on him. He loves to go for his walks. We got these kind of gullies or ravines in between our communities. They got bike paths through them. And when you get in there, it's almost like getting out of the city for just a short period of time. It's a great thing. But he loves it. Back when he was a pup, he's a golden retriever with the dark copper color. And he's got a white patch on his chest, a little bit of white on his belly. And when he was small, he had a little tuft of white hair on the top of his head. So I used to call him Stains. That's what I called him originally. And my wife didn't seem to like that too much. And I guess, realistically, standing outside in the yard at 1 o'clock in the morning yelling, Stains! Stains! Come, Stains! Come, Stains! I guess it didn't go over too well with the neighbors, and they started hiding their kids and stuff until she pointed out, and we changed his name to Daytona after that. So we got a great show lined up this week. One thing I will say is we're not going to touch much on the USA situation right now. We got a big story coming out of Canada the last week. Also, we're going to talk a bit about the Brexit and what that means in the UK. Also, an interesting article from a study done by the TPD in the EU. And also, our device debut this week will be a starter unit, the Joytech AIO. Got one for the wife. Beautiful little device. And something very special for you this week. My Vaping Story, our special guest this week, somebody that I have a great deal of respect for. He was one of the first YouTube celebrities that I started interacting with out of Minnesota. The infamous Gizzard Stew will be on the show to tell us his vaping story, and what a great story that was. I always enjoy talking to Giz no matter what it is. Just a lot of fun, great guy, a lot of respect for him, knows his stuff, and is all about keeping people on track as to the true nature of vaping. And we will do a little bit of a permit to piss me off near the end of the show. And while sitting here recording the podcast, vaping on a little bit of Jughead Silky Mama. It's a juice that I honestly didn't think that would really appeal to me. It sounded interesting, but once I got it, it's like a summertime drink vape, if you can feature that. Fresh strawberries, pina colada, and a scoop of minty ice cream. Sounds like a bit of a combination and a half for me personally, but it surprised the heck out of me, as do most of Jughead's juices. Check them out, jugheads.co. Very difficult right now with the looming Canada postal lockout / strike. The previous 2 strikes that we've had over the last few years since 2009, I think both lasted around 2 weeks. So we're hoping that they can get the issues resolved, get on track, and keep the product flowing to us vapers that rely on vape mail. We're going to be going through withdrawals. Okay, let's get the Fogcast rolling this week, and we'll start off again with our worldwide advocacy tour. And we're going to start off once again in our own backyard in Canada. A big story come down the pipes this week. It's looking pretty bright as far as I can see. It could go either way, but let's take a look into it. If you're followers of the regulatory watch, I watch it quite often, but they came up with a great report this week, and basically often overlooked is the Canadian federal government. They're set to flex their muscle in the regulatory debate over vaping. Under consideration is a new national regulatory policy developed in part for the recommendations of a groundbreaking parliamentary report on e-cigarettes, which came to a standstill when follow-up collided with the priorities of the 2015 federal election. Now, with the Trudeau government in full swing, the provinces are dotting their I's and crossing their T's on their provincial regulations, and all eyes have turned to Health Canada, who was handed the HESA report, and it will evaluate a very different regulatory framework, one that could upend provincial regulations before the ink is even dried. The HESA report, or the House of Commons Standing Committee on Health, Vaping Towards a Regulatory Framework for E-Cigarettes, was produced by the Standing Committee on Health and is back in play as of June 15th, when the federal Liberals introduced the report into the House of Commons. It's now up to the government to present a comprehensive response, which is expected to come from Health Canada. So what's in the report? In late 2014, early 2015, the HESA committee conducted 8 meetings, hearing testimony and receiving evidence for nearly 50 individuals and organizations on potential risks, challenges, and benefits associated with vaping. Witnesses included device manufacturers, e-liquid producers, stakeholder organizations, medical experts, and everyday vapers themselves. By all accounts, it was a thorough and fair hearing of the evidence, resulting in 14 recommendations by the committee. The key one being that the Government of Canada would work with all affected stakeholders to establish a new legislative framework under the Tobacco Act, a new legislation, or relevant statutes. A commitment to develop a new legislative framework is seen by the vaping industry as a win. Yet the thorny details still have to be worked out, and those stem from the push and pull of regulating vapor products as either tobacco products, therapeutic products, or for consumer products. Each bring their own similarities and differences to vaping. The industry believes that the solution is to enact a purpose-built regulation that specifically defines vapor products in a brand new category of its own. Daniel David, chair of the board of Electronic Cigarette Trade Association of Canada and director of the Canadian Vaping Association, said that the provinces do not deal with quality control. They have no jurisdiction on nicotine. There is this separation of powers that goes on. The federal government regulates and the provincial government is responsible for regulating. And what we're seeing right now, even the worst case scenario, Quebec, for example, is in this situation. And it's nothing compared to what the federal government could do, as strict as some of the provincial regulations are. And at the end of the day, it could get much worse. Ultimately, the federal level of government is the only level that could actually kill the industry. But the likelihood of them doing so is negligible, he said. The fact of the matter is, they put out their announcement in 2009, and since then, the industry has grown exponentially. There are now hundreds of thousands of vapers in Canada, and the government realizes at this point that it has grown so large that the repercussion of eliminating the industry is going to create a black market that they simply cannot regulate. The HESA report is extremely important because the federal government really took to listening to the entire spectrum. There are already product categories in place such as tobacco, medicinal, and consumer. The realization is, when looking at the HESA report, no regulatory category that exists right now suits the tobacco harm reduction product that we're dealing with. What we need and are working toward is a purpose-built regulation that specifically defines tobacco harm reduction products. Our entire public health system is built on the basis of harm reduction. We need to classify this regulation on its own and as a harm reduction product, not a cessation product. Vaping would not be a good fit in the medicinal category as it is not a pharmaceutical. Vaping's consumer-driven industry is not capable nor applicable to fall in the category that would simply kill innovation. As this progresses, we'll continue to follow it very closely. It's going to be interesting to see what Health Canada has to say. And I believe strongly things are looking good. The Canadian government is playing it smart. Hats off to our Canadian Vaping Association, the Electronic Cigarette Trade Association, the manufacturers, the e-liquid producers, everybody involved, realizing that vaping is a benefit and that it shouldn't be classed as a tobacco product. So let's move on to the UK. June 23rd, the UK voted to leave the European Union, and we're going to take a little bit of a look into the insight as to the fallout and how it affects the vaping community. But as you know, the TPD had some pretty strict regulations in place in the European Union, and with the UK deciding to go it on their own, how does that affect the vaping community? Well, e-cigarette industry body will seek talks with the government to discuss whether EU vaping legislation can be renegotiated in the wake of last week's Brexit vote. The Independent British Vape Trade Association, or the IBVTA, said that even though the European Union's TPD was transposed into UK law back in May, the organization will still seek clarity for its members on whether there could be any future changes to the law. The EU's TPD legislation was transposed into the UK law in May. The law was widely blasted by the vaping industry for stipulating strict clampdowns on e-cigarette advertising, banning it in print, on television and radio, as well as clamping down on strength and flavors of the e-juices that can be used. Under the legislation, manufacturers are also required to notify government bodies about new products 6 months before they're launched. Some argued that this would stifle innovation in an industry driven by emerging product design. As a trade association, IBVTA will be meeting with government officials as a matter of priority to discuss the full implications of the referendum result, and will continue to make a case for sector-specific and proportionate regulations for the independent vape industry. What we do know is that the UK is still a member of the EU as of right now and is bound by all obligations of its membership. Therefore, at this moment in time, the tobacco and regulated product regulations are still binding, and the industry still needs to comply with them. What happens next will depend on wider negotiations between the government and Brussels and the exact nature of the UK's future relationship with the EU. It is this that will determine whether or not the current regulations remain in force beyond the point of the UK actually leaving the EU. However, Chief Executive of Action on Smoking and Health, Deborah Arnott, warned it is unlikely the government would be open to discussing regulations that are already UK law. The government is not going to withdraw these regulations, one being that they include rules on the standardized packaging as well as e-cigarettes, and manufacturers are already making their products to the standards stipulated by the TPD. As well as introducing new rules on e-cigarette, a range of tobacco restrictions were also included in the law, such as a ban on menthol cigarettes and standardized packing regulations. This is the beginning of a long and complex process. All matters will be considered in due course. More than 6 million smokers in the European Union have quit smoking, and more than 9 million have reduced cigarette consumption with the use of vapor products and electronic cigarettes, according to a new study published in the journal Addiction. Scientists from the University of Patra in Greece, Onassis Cardiac Surgery Center in Greece, and the French National Research Institute for Health and Medical Research analyzed data from a 2014 Eurobarometer survey on smoking and the use of electronic cigarettes. According to the study finding, 48.5 million Europeans have ever tried electronic cigarettes, but 7.5 million are current users. Among current users, 35.1% have quit smoking, while an additional 32.2% have reduced their cigarette consumption. These are probably the highest rates of smoking cessation and reduction ever observed in such a large population study, said Dr. Konstantinos Farsalinos, the principal investigator in the study. The European Union data show that the use of electronic cigarettes seems to have a positive impact on public health for two main reasons. High smoking cessation and reduction rates are observed. And number two, the electronic cigarette is used largely confined to smokers, current and former, with minimal use by non-smokers. Very interesting indeed. There's more and more positive reports coming out all over the globe now showing that they're heading in the wrong direction by trying to eliminate this industry. And it's something that I honestly believe at some point has to turn around. And as much as I love them, man, the American authorities, you got to get your head out of your ass and quit thinking about your pockets and think more about the health of the people that you govern. So continuing on our worldwide advocacy tour, as mentioned, there is a lot of news coming out of Australia, and we're going to talk about that hopefully next week's podcast. My buddy Paul from Australia, Labworks Vapes, he's had some personal issues to deal with this week, unable to join us. And I don't want to get too deep into the issues in Australia without having him in the conversation. We want to get that information straight up and from the source, and we'll do that next week, hopefully. That is going to wrap things up for this week's segment of the Worldwide Advocacy Tour. Now, before moving on to the device debut segment of this week's show, which is for the Joytech AIO, I just wanted to give a bit of a shout out. Now, when it comes to advocacy or being an advocate in the vape community, it's not always about keeping up with all the news on government regulations, crackdowns, bannings. It's also about proper education and safety, also keeping up with products and good consumer experience. I happen to have one of those great experiences this past week. Now, I was in the market for some more wire. I happened to come across a website for a vendor in Edmonton, which is about 180 miles, 280 kilometers, give or take, north of me. And they had a pretty interesting little site. They've got a great selection of hardware, juices, accessories. In their coil section, they have all the coil heads for all the tanks, but I happen to notice they had some pre-made coils that they have a higher end line called the Alambre. They're about $30 for a pair. They also had these Chinese manufactured pre-made coils as well. They came in Kanthal or stainless steel, 10 coils for $4.99, 50 cents a coil. You can't beat that in my estimation. But the one thing that appealed to me was they had alien Claptons. I've never ever tried an alien Clapton before. So I put in an order for 40 of those combination of aliens and regular Claptons, etc. They also had the Demon Killer notch coils. So I thought I'd try those out as well. And those are $8 for a pack of 10. So I ordered 50 coils in total, and it was $34 or something like that after shipping. That was on a Sunday night, and I received it in my mailbox on Tuesday morning. Very, very impressed with the speed of the service. And I emailed them, as I do when somebody does a good job, I'll let them know they've done a good job. So I emailed them just to tell them how impressed I was with the shipping and the service. I got an email back thanking me very much for my patronage. Hope that they see me again. At that point, I'm even more impressed. They obviously pay close attention to their customers and are doing what they can to make it a good experience. So hats off to Vince and the staff, friendly staff, knowledgeable staff. Great experience. I can't wait to do business again. I actually cannot wait to get up to Edmonton myself and to go in personally and check it out. I've seen images from the inside of the locations, and it looks absolutely fantastic. So you can visit them, vapehorizon.co. And also, if you're in Edmonton, 7603 104th Street Northwest, Edmonton, and 14820 Stony Plain Road Northwest on the west side. Do check them out. Great selection, great customer service, great people. Highly recommend it. So this week's device debut, we're going to look at the Joytech AIO, the all-in-one. It's been around for a while. I started off vaping with multi-lung devices. At the time, technology wasn't quite there, but today there's some great products out on the market. You've got Innokin's T18 and T22. I personally have tried the T22. I'm trying to convert my wife to full-time vaping. She's vaped before. She vapes periodically now. She didn't quite get into the T22 for whatever reason, but I went out and I picked up one of the Joytech AIOs. It's an amazing little device. It's very simple, very straightforward. It's perfect for the person looking at possibly checking out vaping. It comes in, 5 different colors. There's a black gray color, a red white, a black and white, a black, and just silver. And being an all-in-one, it's got the best anti-leaking structure with a 2 mil e-juice capacity. It's got a child-proof lock system on top. You have to press it down and twist it to open it up to fill it and to change the coil. And it's got the 5-click fire button to turn on and off as well. And that's it. There's no reading. There's no setting of wattage or volts or anything else. It's just a very straightforward, straight up device. The battery is built in and you plug it in to charge. One cool feature for whatever reason, if you might be into it just for design sakes, is you can change the color of the light inside to change to whatever, but a nice tight draw for those that want to experience the mouth to lung type vape. There is an air control on it. It's not quite as tight, I find, as like the T18, but it's got a fairly tight draw on it, and it's just a very good little device for the beginner and even for the advanced that just wants to carry something small around with. It comes with 2 coils. They're both stainless steel 316 0.6 ohm. 2 drip tips for it. I'm going to call it a mouthpiece. It's really not a drip tip in this sense, but you get my drift. There's the color match one for whatever color device you end up getting, and then there's also a clear one as well. You get a USB cable with it for charging, and your quick start guide and a warranty card. They stand 19 millimeters in diameter, 118.05 millimeters in height. It is a 1500 milliamp battery. It's a 2 mil capacity atomizer. Find your favorite vape shop, check it out. Down at vapercanada.com. That's vapercanada.com. $22.50 Canadian right now, which is a fantastic deal. And you don't get much better than that. Do check it out. Great little device. Great for the beginner, and also not a bad little travel device if you're shooting to the store or out for a walk with the dog or something of that nature.
Hello, I'm Gizzard Stew, and this is my vaping journey.
My vaping story this week, we have a good friend of mine and everybody's friend and favorite, Gizzard Stew. Welcome to the Fogcast, Gizzard. Great to have you with us.
Well, hello, Permit.
It's awesome to have you. Thanks very much for taking the time out to tell your vaping story. I've spoke to you several times, and I know you've got a very inspirational story, and that's one of the main reasons that I wanted to have you on the show.
Well, I don't know how inspirational it is, but it is a story.
And by the way, I couldn't help but notice you're not wearing any pants.
I do all of my podcasts in the nude.
Well, I wish you could have told me sooner, but that's okay. I'll shut my monitor off and let you tell your story.
So what you're saying is you want me to bare my soul, but not necessarily the rest of me? Like a lot of smokers, I started smoking when I was around the age of 15 or 16. I think back to that, and it was strange because I think that I started smoking just out of like puberty angst. are that little bit of rebellious teenage anxiety a lot of people go through. But I do recall starting with, of all things, more cigarettes, and they were about 6 inches long and the width of a swizzle stick. So that was what I started smoking, and I used to go to the schoolyard and I would bring toothpaste with me so that when I returned home, hopefully my parents wouldn't know that I'd been smoking. But seriously, cigarettes for me had turned into a lifelong addiction. For the most part, smoked nonstop for over 32 years. I had tried to quit numerous times, on numerous occasions, with numerous methods. I had tried gum and patches, snus. I think the only thing that ever came close for me was quitting cold turkey, because I did manage to quit cold turkey once for about a year. And then what happens to a lot of people happened to me, and that is that I had I was going through a hard time, had some anxiety going on in my life, and jumped right back in to smoking cigarettes again. More up to date, long story short, jumped to 2013. I tried vaping for the first time. The equipment that I was using was like a Ego style pen with a C4 plastic atomizer on it. The vape shop that I bought this from, they started me out with 24 milligram nic, and as you can imagine, that made me cough quite a bit. I recall asking them for a recommendation on a juice to start with, and they started me off with their house special, which was cranberry pomegranate juice. And needless to say, that was kind of a failure for me. I couldn't make the transition with that garbage setup and that awful juice. Then in 2014, I had some health issues and ended up in the hospital after having H1N1 flu. It was a bad deal. I was very sick and came out the other end of that. I knew that I needed to quit smoking. So in the fall of 2014, I went back to the vape shop. I got another vape pen. I started doing research on vaping myself and mainly started watching YouTube videos, Grim Green and Indoor Smokers, people like this. And I found out that the equipment that I was using was probably not the most satisfying available. And I ended up getting a Nautilus tank and a DNA 30 mod. And with that, I was able to transition to where I wasn't smoking at all. And then, as a lot of you know, recently I had a couple videos that I put up on YouTube that kind of explain my vaping journey. Mainly, my vaping journey has been through YouTube videos. I was able to learn most of what I know about vaping, and it just was a good tool for me. Also, the community that was involved, I became a little bit more involved with the vaping community and found a lot of people very helpful and supportive. And I really attribute my being able to completely succeed in cigarette cessation because of the many people that I mainly met through YouTube, and that community was an invaluable support group for me. So I'm not sure that I would have been able just to quit smoking by the use of vaping equipment alone. For me, because I had smoked so long, I think what was put me over the edge was the support of our vaping community. And as I became more involved with the community, I began trolling on various live shows and things like that. And eventually I was kind of goaded into getting a web camera. And since then I have regularly been appearing on YouTube live shows. Shout out to Fresh E03. He is a big mentor for me and still is. And I've been off cigarettes for 2 years, over 2 years. So as I progressed as a vapor, one thing I learned along the way was, and I think all vapors should know this, is what is in your e-liquid? What is your e-liquid composed of? For the most part, there's 3 things in e-liquid: propylene glycol, flavorings, and vegetable glycerin. Unlike cigarettes that have literally thousands of chemicals and thousands more when combusted, vaporized e-liquids are very benign, in my opinion, in comparison. And as I learned what was in the e-liquids, and I started hearing about people that were making their own e-liquids, and because I didn't have a huge budget to be spending on tons of commercial e-liquids, I got into do-it-yourself. And I really first got into it because of Fresh E03. I used to follow his shows, and every week I saw him mixing up his own e-liquid. And he would tell people, it's really not that hard. You just have to start somewhere, and from those humble beginnings, I have been actively learning how to do it myself for a little over a year. It's become kind of a hobby for me, as well as an excellent way to support my vaping habit more cost effectively, because it's obviously a lot cheaper to make your own e-liquid. And because of what's going on with the FDA deeming regulations in the United States, I, for one, believe that DIY is the future. They're going to try and regulate the crap out of the e-liquid manufacturers. And not that they don't need some regulation. I believe that they do. In the way it's written now, they're going to put a majority of these small businesses out of business. I really see that DIY is going to be the future. You might as well jump in, get your feet wet. A good way to do that is through the few e-liquid companies that are selling concentrates. And what a concentrate is, it's simply their flavoring mix. It's a mix of flavors that is their proprietary recipe, and they provide that. And basically all you have to do is add VG and possibly PG to it, your own nicotine base, and off you go. And for myself, a lot of times I'm down to 0 nicotine in my e-liquids, so I don't even have to worry about adding nicotine anymore. I get a concentrated e-liquid, which is basically just flavorings. I add VG to it, part A and part B, mix it together, steep it for a week, and I'm good to go. So I think that if you're not looking to do DIY, you're not on the curve as to where viable, sustainable vaping is headed. I do run into people. I have friends of mine that still smoke. What I've found out from my experience is that a lot of these people have misconception of what vaping is. A lot of times what I get from smokers is, oh, you're vaping? Oh my God, that's way worse than smoking. And I'm like, no, you've been misinformed. And then I bring up points and try and explain it. But it's difficult to change people's perceptions. And I believe these perceptions came from vaping being portrayed inaccurately in the mass media. One of the things that they say is that nicotine is the addictive component found in vapor products. And what I've found out through my research is that nicotine is not the addictive component in traditional tobacco products. Nicotine is a stimulant, much like caffeine. Freebase nicotine is very addictive. To make it freebase, you have to manipulate it. And that's what Big Tobacco has done, is they have manipulated it. Actually, nicotine in its natural form is found in eggplants, tomatoes, cauliflower. And last I heard, nobody has become addicted to nicotine because of eating tomatoes. The mainstream media also doesn't really seem to care about the health of tobacco smokers. Otherwise, they would embrace vapor products as a harm reduction alternative to cigarettes. Vapor products have allowed millions of smokers to achieve cessation from cigarette smoking, yet the mainstream media has the audacity to blast vapor products through campaigns of misleading billboards and other disdainful propaganda. And I have to assume that either they are woefully misinformed or they are willfully and intentionally deceiving the public. A lot of times I find it difficult to convince even friends of mine to try vaping because they already have it set in their heads that it's worse than cigarette. But, if you put the effort forth, I have converted a dozen of my friends that are no longer smoking because of vaping. But I find it difficult sometimes to convince people it's a valuable tool. And then you have the perception of people that don't smoke. They're even harder to convince because A, they never smoked, and B, they don't care. They don't care about smoking, and they care less about e-cigarettes, and they have bought into the propaganda that vaping products are worse than smoking as well. So I feel that our greatest challenge in this fight to propel vaping into the mainstream as an acceptable smoking cessation tool is education. It's hard to get people to listen even because they're disinterested. It's paramount. It's the most important thing that we have going on right now, because if we do not advocate in the United States anyway, our government's going to have their way with the industry, whether their motives are clandestine and based on money. Pretty obvious that, it's not a good thing. So I believe it is very important that we advocate. Like I just said, I think initially the most important thing is education. That would be my top priority. If you look back to the 60s, almost 50% of the population of the United States smoked. Recently, it is finally dropped slightly below 20%. And of that 20%, I would say maybe 3 to 5% of those people might be vapers. That's probably being generous. It's probably a smaller percentage. That means that you have 95% of our population that either doesn't smoke, or they smoke but they don't care about vaping, or they're misinformed about vaping. So educating 95% of a population would be the most important thing to me in a step towards changing people's perceptions of vaping products and harm reduction. The second point that I would say is most important would be to advocate in such a way that you're contacting your representatives. If you don't have money to support these groups, you can certainly at least write letters. Write your representatives. It's better to try and write them a analog letter, put a stamp on it. Handwritten letter does a lot more than an email. If you send them a handwritten letter, they have to open it. More likely that that's going to be read than just an electronic correspondence. CASA would be the number one organization, in my opinion, for that, because they're very good about sending you, once you sign up, they'll send you local as well as national calls to action. They're the ones that are tuned in to the timing certain times come up where it's imperative that we blast our representatives at a certain focused point in time. And they're the ones that are tuned in to being able to direct you to do that so that your contact point is most beneficial at certain given points in time. The third part of the advocacy is financial support. You know, if you have the means to support all of these groups, support all of these groups. Support CASA, support Not Blowing Smoke, support AIMSA. And we all used to smoke cigarettes. Everybody used to spend at least $5 a day on smoking. You know, if you can put that budget in a jar for a week and take half that money and send it in for advocacy, that's what we need, because at this point, you know, we need to support these lawsuits. It's not going to be cheap. One final message that I would like to share is that while on my personal vaping journey, the key to my success has been the vaping community that I've become a part of. Without all these great people I've met from all over the world, I am certain that my path would have been filled with obstacles that would have taken me much longer to hurdle. I want to thank all of my vaping compadres for nurturing my growth as a tobacco-free human. And remember, get off your cigarette butts and vape.
And there you go. Once again, Gizzard Stew with his incredible story on how vaping has positively impacted his life. And he's a man who likes to have fun, keeps everybody smiling, but he's also a man that is passionate about helping others and cares deeply about continuing to pave the way for those that have yet to discover tobacco harm reduction. I can't thank you enough for all the encouragement and support you've given me over the last year or so, buddy. And I'm honored and grateful to call you my friend. And thank you very much for telling us your story and being a part of the Fogcast. Your can of maple syrup and Jughead's sample pack is on its way. My vaping story this week was brought to you by Vapor Canada, VAPRCANADA.com, Canada's #1 source for vaping equipment, e-juice, and more. Amazing service at amazing prices. 24-hour flash sales, affiliate programs, and a great loyalty program. Earn points on purchases for discounts on future purchases. They offer free shipping for orders over $150, and that's Vapor Canada, VAPRCANADA.com in Calgary. That's on the 3rd floor, 100 4th Avenue Southwest. They're open 11 a.m. to 6 p.m. Monday through Friday, and weekends by appointment only.
Permit to piss me off.
So recently something came to mind with all that's going on in the U.S. We're drawing ever so close to that August 8th deadline. And if you haven't already, please visit august8th.org and keep up to date on everything that's happening. The market will freeze as of August 8th. And recently, when it comes to the FDA, something that I really started to think about, it pisses me off. The FDA, if you look at their webpage, it states clearly, the FDA is responsible for protecting the public health by assuring the safety, efficiency, security of human and veterinary drugs, biological products, medical devices, our nation's food supply, cosmetics, and products that emit radiation. The FDA is also responsible for advancing the public health by helping to speed innovations that make medicines more effective, safer, and more affordable, and by helping the public to get accurate, science-based information they need to use medicines and foods to maintain and improve their health. The FDA also has responsibility for regulating the manufacturing, marketing, and distribution of tobacco products to protect public health to reduce tobacco use by minors. Finally, FDA plays a significant role in the nation's counterterrorism capability. FDA fulfills a responsibility by ensuring the security of the food supply and by fostering development of medical products to respond to deliberate and naturally emerging public health threats. So this has been since 1906 when the Pure Food and Drug Act was introduced. Since that time, you stop and think about how many medications have been put on the market that have been pulled later after FDA approval because of major problems that it caused to the people that use them. And think about cigarettes and tobacco in general. So how long has tobacco been legal in our system? Widely accepted, widely used, knowing that it causes cancer and it's killing millions and millions of people. Yet in less than 10 years, they're threatening to wipe out an entire industry. And it's a product that is not killing anybody. Let's forget about vaping and cigarettes for just a moment. Have you ever wondered what's in your food? It's much more than just what you see. I mean, years ago, we knew where our food came from and what was in it. Now, the global markets have vastly expanded and we know less about what we eat. More food is coming from places that we have no insight to its production before it even hits our borders. We know the obvious, that there are chemicals that are added to our foods to preserve and package them, as well as to make them look and taste better. And sure, there are the familiar ones like sugar and salt, but many are not so familiar. Many decisions about what goes into our food is made without the public's knowledge. This is where agencies such as the FDA are highly dependent upon. Even the FDA is left in the dark when it comes to what chemicals are ending up on our plates. In 1958, in the U.S., Congress passed a law that intended to ensure that chemicals in our food supply were safe. Back then, Congress and FDA didn't anticipate how advances in science and technology would transform our food. At the time that the bill passed, there was about 800 chemical additives in food. In the 60s, that number jumped to over 3,000. Today, there is an estimated 10,000 chemicals making their way through our food chain, and many get through without any FDA review for safety. The 1958 Food Additives Amendment allows common foods to bypass FDA review as long as generally deemed as safe. This may have made sense back in 1958 when common ingredients were such things as oil and vinegar. The loophole has basically crushed the law, allowing uncommon chemicals to be added to food without any FDA oversight. Today, the FDA allows food companies on their own to determine whether an additive is safe and decide whether to use it without any input from the agency or the public. In fact, the FDA has never reviewed the safety of more than 3,000 chemicals used in our food supply. Think about that. They have never reviewed more than 3,000, but yet there's 10,000 in our food chain. Often the FDA hasn't even been notified that a company will include a different chemical in its food. And as of 2014, an estimated 1,000 chemicals are only known to the companies that use them. We can't even rely on the ingredient lists on the packages to help us determine what is in it, because there are an estimated 5,000 substances that aren't required to be included in the ingredient list. So realistically, the FDA doesn't really have full knowledge of what is in our food chain, but they are an agency designed to protect the health of its citizens. So with this insight, what is the real agenda when it comes to the attempted destruction of the e-cigarette industry? Why the focus on it instead of the food chain that affects the entire population, as opposed to an industry that's only affecting 5 to 10% of its population? Which, by the way, the food part of it includes children. They're eating all these things. But that seems to be the main facade of what the FDA claims is to be one of the major issues with vaping. keeping it out of the hands of children. Several international studies have shown, if they paid attention to those studies, that smoking among teens has drastically decreased due to vaping. And number two, most included in those studies have vaped for just the flavors and have not vaped for liquids containing nicotine. Under the Bush administration, the FDA started to undermine enforcement and betrayed its customer-first legacy. It's time for the FDA to start enforcing the law and return to a culture that places public health concerns ahead of industry profits. From what I've seen when confronted by the public on social media, their answers are as vague as, well, as Sigelli answers to the 213 fiasco. The answer I've seen most is, we're not banning the products. Companies have the opportunity to have their product on the market by applying for a PMTA. And for that price they're estimating to apply for that process, what companies, if any, will survive even that process? Mr. FDA, if you are truly responsible for advancing public health and helping to speed innovation, you'll need to come up with a better answer than that to help us realize that you're not just blowing smoke up our asses. And that is going to wrap up episode number 3. Thanks very much for listening. Thank you very much to Gizzard Stew for sharing his story with us. Thanks very much to my sponsors, jugheads.co. We've got the Vapers, Jugheads, the finest handcrafted juices in Canada, and also to Vapor Canada. Next week, we'll have lots of news out of the USA as we draw ever so close to that August 8th deadline. And also Paul Blamire from Labworks Vapes in Australia, hoping to get him on so we can talk about the devastating situation that is taking place down in Australia. Thanks very much for listening, everybody. Stay healthy, stay happy, and keep on vaping.
Yeah, I'd like to take this time to flip the tables on Permit the Fog and ask our host a few questions. Permit, are you ready?
Absolutely, Gizzard.
Okay, Permit, I've always wondered, seeing as you're Canadian and all, if you had a slip and slide in your backyard, what would you lube it down with?
Well, that's a no-brainer. I'm going to have to go with maple syrup.
Damn, I knew it. If I could only take one mod to my deserted island, it would have to be the mod from Harold and Maude. I'm sorry, but the mod from the Golden Girls is off the table. I'm just not attracted to her. Are you going to include these outtakes, Permit?
Probably not.
Question number 2. Permit the Fog. If you could stop vaping into your mic, I would ask the question. Permit the Fog. I have an important question for you. If you had a dog, a squirrel, and a rabbit, which one would be your best friend?
A dog, without question.
And why, Permit?
Because
Because you wipe peanut butter on your balls?